Insurance companies require that your clients have a DSM diagnosis in order for them to qualify for ongoing therapy services. So, arguably, the most important thing to come out of an intake assessment is your client's diagnosis and your justification of that diagnosis. If you're newer to the field, I highly recommend that you pick 5 diagnoses that are most common to the populations that you see and get really, really familiar with the symptoms of those diagnoses. So for me, that would probably be generalized anxiety disorder, major depressive disorder, the adjustment disorders, and let's say ADHD. Literally Google DSM criteria for X diagnosis. Create yourself a document, say the diagnosis, and then bullet point the criteria that a client needs to meet in order to qualify for that diagnosis. The more exposure you have to the qualifying criteria for a diagnosis, the easier it will be for you to see these criteria in an assessment with a client without having to spend the whole session really focused on specific assessments. Having a really solid understanding of these diagnostic criteria also allows you to translate some of what the client is saying into the language of the DSM. So the client might not use the language of feelings of worthlessness or excess rumination, but based on what they're telling you about what they're experiencing, you will be able to recognize how those symptoms relate back to the DSM diagnosis. And remember, you can always update your diagnosis based on future information. You do have to have a diagnosis to bill for that very first session, but that doesn't mean you're locked into that diagnosis for the rest of forever. So find a couple of diagnoses that cover the basis pretty well, and then you can continue to learn and grow how to diagnose more specific things as you continue working. Now, people get really freaked out about the term diagnostic justification, and they really overcomplicate it sometimes. All it means to include diagnostic justification in your documentation is to say the client meets the criteria for this diagnosis according to the DSM. So because I like overkill, I include a little statement in every single piece of documentation that basically says exactly that. The client meets these criteria for this diagnosis, the end. But you're also demonstrating the justification of the diagnosis through the things that you write in your documentation. So when you describe the symptoms that the client is telling you about, you're justifying the diagnosis. If you're trying to figure out what to include in an intake note and what you can leave out in order to protect your client's privacy, thinking about the note in terms of diagnostic justification is a great place to start. Maybe the client just told you a really in-depth story about a conflict with their mom. As you're deciding what information to include in that, you can pick out the pieces that support the diagnosis. And you can leave out the details that don't necessarily add anything to that.